We all had been living and breathing the contract for almost a year at that point in time. And there's a lot of assumptions that you make when you go out to actually operationalize it. So we had to pivot pretty quickly and be able to go in and start leaning on our change management methodology a little bit more and have some more dialogue with those end users to be able to have them fully understand what the expectations were and how to work a little bit more effectively together.
Working with the Philips team, we had our leads who we would directly communicate with, several meetings, obviously, to make some big decisions. We did some site visits outside of Ontario and outside of Canada at some point to really be able to see what other hospitals could offer, what the companies could offer. That really reflects in going with the type of pump we did. So we went to the actual site and saw all of the options and all of the integration that could be done. Even meetings about how we wanted our screen configured. So we would sit down with the Philips team directly, and so we were able to really customize it to the workflow that we needed here at Mackenzie Health, not necessarily to the same thing that is needed in a downtown academic center or even another community center. So we were really able to communicate with our Philips team about what our needs were, and they were able to meet exactly what we needed in the operating room. Our main focus is that if everything can communicate with each other and we only have to use one setting or go to one place and everything else simultaneously responds, then our focus can be on the patient and not on the machines or the technology. I really was impressed with how Philips worked with all of our vendors and to get us that two-way communication, either future state or currently. MES has been one of the greater things we've done in this process because although we have a manufacturer of our anesthetic gas machine who is not Philips, because they manage all of the technical, the equipment, the service, and any sort of technical support as well, using one link or one communication has made it very, very seamless. So having that one MES communication and that ability to call a single number and get the support you need for the operating room is really helpful versus having 10 different manuals and having to work together.
It's unlocked new clinical value because we've been able to work directly. Being embedded in this hospital, you really get to know people. You understand their workflows so much better than when you sell a widget, a piece of equipment.